Hello, and welcome to the NAMI California podcast about our wonderful annual statewide conference. We're joined today by three people who will be speaking at our conference soon. I'd like to introduce them to you before we start talking today. Kirk Lord is a sophomore at Pitzer College who studies science management on a neuroimmunology track, and he competes in track and field for his college. He is the founder and executive director of National Pandas PANS Youth Alliance and has been involved in neuroimmune advocacy ever since he was in fourth grade when he pogo sticked across the Golden Gate Bridge nonstop. Don't worry, he didn't fall. He did it to raise thousands of dollars for Pandas PANS research funding. Outside of school, sports, and advocacy, Kirk enjoys skateboarding in his free time and works at a physical therapy clinic when he's home from college. Brandi Alden is a nationally recognized public speaker and licensed brain health trainer with a passion for advocacy. As head of event organization and outreach for the National Pandas PANS Youth Alliance, she works to amplify the voices of patients and families nationwide, drawing from her 11-year journey with the condition. With a dynamic background in performing arts, Brandi uses her platform for over 7 million followers to raise awareness and inspire action. And last but not least, we have Kat Doherty. Kat is a passionate advocate, storyteller, and founding member of the National Pandas PANS Youth Alliance. After surviving PANS and years of misdiagnosis, she now uses her voice to raise awareness, build community, and push for better treatment access. Kat believes that no one should have to fight alone to be heard or to heal. Amen to that. All right. So I know that there are many viewers that probably don't have any idea what PANS or PANDAS is. So Kirk, could you give us the easy version for those of us that don't know all of the medical terms for what exactly that condition is or conditions are?
Yeah, so pandas and PANS are both neuroimmune conditions, and they're very related. So PANDAS stands for Pediatric Autoimmune Neuropsychiatric Disorder Associated with Strep, and PANS stands for Pediatric Acute Onset Neuropsychiatric Syndrome. So essentially, these two disorders typically onset in childhood, although they can onset or start a lot later in life too. Both of them are caused by either genetic or environmental or both of those factors. So you can have basically a genetic mutation or just basically get really ill. And eventually that can kind of trigger an autoimmune reaction in which your immune system mistakes your basal ganglia for the infection trigger, essentially. So basically, your immune system produces autoantibodies. And basically, there's a difference between antibodies and autoantibodies. Antibodies is just kind of a normal component of the immune system. They're responsible for tagging infection triggers. And you can also produce autoantibodies, which mistakenly target bodily tissues. So those bodily tissues can be anything. And in the case of pandas and PANS, it's the basal ganglia. So that's a part of the brain that is responsible for emotional function, emotional or cognitive function, emotional regulation, and motor function. So that area will get very inflamed when someone gets an onset of PANS or PANDAS. And that can result in a lot of neuropsychiatric symptoms, including anxiety, depression, OCD, motor tics, and in more severe cases, seizures and psychosis.
Right. Thank you so much for that summary. Kat, as I'm listening to what Kirk is saying, it sounds like a lot of other conditions that I'm familiar with, maybe lupus or some others where they're often misunderstood and misdiagnosed. So could you talk to us about how you discovered that you had the condition?
Yeah. And just like you said, it does kind of mimic certain other conditions that are often misdiagnosed. For me, it was such a sudden onset of psychiatric symptoms that we knew something was wrong. I was so not myself that we were just kind of desperately searching and stumbled upon this, and I had every single symptom. But what was so difficult was that even when we saw it and we thought, that I had this, we still had trouble getting a doctor to treat it or if we had like a naturopath who was saying, this is it, but I can't get you the medicine right now. So there's a lot of, even when you fight for that diagnosis and you find it and it so clearly matches, there's still a long journey after that.
Thank you so much for sharing. I can definitely connect that to a lot of our individuals that we support that have mental illness and are trying to find someone who can treat them and not make assumptions about what's wrong just based on symptoms alone, but are looking at the holistic person and trying to figure out what exactly is going on with them. So, Brandy, for you, what do you think is the connection between the journey that people often take through these misdiagnoses and maybe being unable to find the right provider and those kinds of things? How does that affect their mental health?
It can have a tremendous impact on their mental health. I know for me personally, my journey started around the age of 14 is when I first showed symptoms. And it took 7 years for me to get a diagnosis. But during that period, I was told by doctors that I was wasting their time. I even had to be admitted to a psychiatric hospital at one point and was told that I was wasting their time at the hospital. So it's
Mm.
not just mistreatment, but knowing and feeling your body intuitively something is wrong, and even your family members and friends recognizing something is wrong. Yet doctors will look at you and look at your blood work that might come back as normal in certain regards and say, well, you seem to be fine. So it's all in your head. And I think that's something that a lot of PANS and PANDAS patients often hear.
So, Kirk, is that what inspired you to create this alliance? Do you feel like there's just a lot of misinformation or no information out there, and that's why doctors are having such a challenging time to treat people and find exactly what's going on with them? Or do you think it's more that, um, you know, assumptions are being made without really listening to what the patient is saying, or both?
I would say there's a lot of no information out there. For me, I was misdiagnosed with OCD, Tourette's, and low intelligence, and that's because they didn't recognize that all of it was caused by strep. So I started this because I noticed that there was a lot of people in the patient advocacy realm, but a lot of them were parents, and they weren't sharing the stories of the people who actually had pandas or pans. So I started this because I recognized that the most powerful and potent thing that could change doctors' minds and legislators' minds were the patient stories. And that's kind of where the most truth comes from, I would say.
Yes, and oftentimes at NAMI, we say that lived experience is the secret sauce to everything that we do because it really differentiates our approach to explaining to people what mental illness is and what it is not. What is your organization doing, if any of you want to comment, to educate people about PANS and PANDAS and also about your organization and what kind of support that youth can receive?
Yeah, so we're posting a lot on social media. We post a lot about neuroscience and also immunology and also just the basics of pandas and pans and also the false diagnosis that a lot of people can have. A lot of times it's OCD, a lot of times it could be seizures, even psychosis. So a lot of that is on social media. We have a lot of resources on our website as well. We're starting to post more on YouTube. And I'd say the most impactful thing that we've done as an alliance so far is traveling to DC and going to 40 plus offices to basically spread awareness to legislators about pandas and pans while advocating for $5 million of research funding towards pandas and pans.
So, Kat, when you went, I'm assuming you went to some of those meetings, maybe all those meetings. That's a lot of meetings, 50 meetings. That's quite a few conversations. What was the feedback or the response from people when you went out and were sharing your story?
Yeah, no, it was really incredible to get that direct feedback, and people were really interested. Some people had heard about it before, because other advocates had gone the year prior, but some people, this was the first time they had heard about it, and they were just so intrigued of kind of hearing our stories and seeing our living proof, like we're the proof that treatment does work as we're sitting there talking to them. And it was interesting because sometimes you'd get someone who says like, my relative's actually getting tested for this right now, so thank you for coming here to talk about it. And so it was just kind of an amazing experience to see how people really were hearing what we were saying.
So, Rennie, one of the things that I was sharing earlier is that oftentimes, especially when you're young, people make assumptions about you, what you know, what you don't know. Oftentimes, youth are seen as the leaders of tomorrow rather than the leaders of now. And you all are really busting that stereotype. And I want to know, Brandi, if you could share a little bit about your personal story and what gives you the courage to be vulnerable and what makes you feel empowered to share your story with others.
Absolutely. For me personally, the fact that it did take me so long to get diagnosed And once I felt this sense of empowerment that covered up all the shame that I had gathered throughout the years going through the medical system and not receiving answers. That has encouraged me to want to speak out about this. My journey, like I'd mentioned previously, started when I was 14. It started with more severe mental health symptoms with OCD, eating disorder tendencies, depression, and anxiety and like panic attacks. And then it escalated into physical symptoms when I was 16. By the time I was 19, I started having seizures that were unexplained, and doctors didn't know how to treat them. So they would often offer me a plethora of different medications with the assumption of like, we don't really know what's going on, but you can try this. And to me, that was shocking. There was once in particular, I went into a psychiatrist and I did a 10-question questionnaire and talked with her about my health history for maybe 20 minutes. But I'd never met this woman in my life. So we were all brand new to each other. She ended up prescribing me an antipsychotic because she thought that might be a good fit, but it felt like we didn't really dive into my health. So I remember I got out of that appointment. My mom and I just turned to each other. I'm like, I don't think this is the right fit. That seems like a really big jump to make when we don't really know what's going on. And no one was testing. When I turned 21, things really took a drastic turn. I became bedridden for a period of time. I could not walk normally. I would have periods of aphasia, which is where I could not speak, almost as if I had had a stroke. I couldn't form words. And I was having seizures that were lasting multiple hours, multiple times a day. And only then did a doctor actually listen and investigate my health. And that's what made the difference. And what's crazy is even at that point where I was bedridden, dependent on my family, it took me 6 months to regain so much of my life back. And now, 4 years later, I'm back in school. I'm working multiple jobs. I'm doing wonderful opportunities like this, being able to present at workshops and advocate for myself. And it just speaks to how having that correct diagnosis is what truly helps you to recover and regain those parts of your life you thought you had lost.
Thank you so much for sharing that. It made me think, Kirk, I know we had talked previously before about how, doctors are trying their best. They can't know everything, but asking really good questions and really listening to the patient and having a conversation makes a difference. And I was wondering if you could share a little bit about your organization and how you're making a difference in that way. How you all speaking out and encouraging other patients to advocate for themselves is helping them to educate providers and give them an opportunity to ask those deeper questions and listen in a more active way to their patients when they're sharing what's going on with them.
Yeah, so we're actively creating resources to help youth navigate doctor's appointments, and also going to conferences like these where there will be physicians and researchers will actually help open their minds up to the possibility that psychiatric symptoms can be caused by biological factors like, from an immunological basis. But one thing that you'll notice with PANS doctors or doctors who treat those disorders is that they spend up to an hour, maybe an hour and a half with each patient, whereas most other doctors will typically spend 15 to 30 minutes maybe just for a checkup. And that's just not enough time to properly diagnose something that's so complicated. And yeah, like every doctor or nurse practitioner that I've been with who has treated PANS for me has spent up to an hour, if not more, getting to know my story, all of my symptoms, and then ordering the right blood work, the right tests, etc., all that stuff. So it really just comes down to the amount of empathy and time that a doctor or a nurse practitioner will have, and that will allow them to properly diagnose someone with PANS or whatever disorder they may have and change their life for the better.
Yes, I was thinking as you were talking about that from a rural community perspective, there's so few doctors already in some of our rural communities. And to spend an hour with anyone talking about anything is very, very challenging. So I really appreciate that you have this resource guide available. I wonder what advice, Kat, you have for people in terms of preparing for those visits. Were you keeping a diary or journaling so that when you came for those visits, if you did have a shorter period of time, did you have everything written down? Did you rehearse with someone what you were going to say so you could feel more comfortable? Because oftentimes the doctor that people are speaking to is usually quite a bit older in age than the person that's speaking to them, or maybe they've never spoken to someone in a position of authority like that. with such conviction. So I wonder what your organization does to help youth to be able to tell their story in a way that's concise enough that if the doctor is pressed for time because they have so many patients, and they want to spend more time, but maybe they're just so overwhelmed with the patients they have, that they ask the patient to come a little bit more prepared. What are the kinds of tips or advice that you give um, to people who are trying to work in partnership with their provider?
I can answer this one. Someone in my
Okay,
community
great,
is actually working on a resource for this at this very moment. And
great.
the things that we discuss adding into that resource are, like you mentioned, a health journal where you can chart your daily symptoms. That way, the doctor has an easy and seamless way of seeing how your symptoms vary based on day to day, week to week. We also discuss how incorporating your family history is so important. That can tell so much about a patient. So, we have a section dedicated to just listing out your family history so the doctor can see that clearly. And the last thing that we help patients focus on are opening statements for their doctors so that they can ask the crucial questions that are most important to them. When I go into appointment personally, I will list out these are the top 5 questions I want to discuss with my doctor. And what I do is I actually send those questions to my doctor prior to our appointment. Say, these are the things I want to go over because ultimately you need to get those answers out of an appointment so that you can figure out what the next steps are. And if the doctor knows all of that information in a concise manner where they know the frequency, duration of these symptoms and which ones you want to focus on, then they can really hone into helping you and cater their treatment to your needs.
I love that you have something so practical for people to do. And it's just really a matter, you're already experiencing these things. It's just a matter of writing it down. And it helps you also not forget some of the important things that you may think are just routine, but that doctor may point out and say, oh, that's the key to me figuring out what's going on with this patient and to treat them in a way that will really be beneficial. So, as we close, could you all share how you found us to be part of this conference? I know we've been working really hard to reach out to new partners, new organizations that have never been to our conference before. So I wonder how you found us and what people can expect from your workshop when you are presenting at the conference this fall.
Yeah. So we found you guys. We found NAMI by Dr. Zoe Gillespie, who's a licensed psychologist, and we were working with her on different things like legislation in California. And she said, NAMI loves youth voices. I think you should apply. And we were so excited as we were looking over, what NAMI does. We'd heard of you, obviously, but we were just really excited to have the opportunity to talk about PANS and PANDAS and neuroimmune disorders and kind of to shed light on that division in the medical field, and what we can really do going forward to ensure that it's a good area and how we can make everyone recover.
And what advice do you have, either one of you, for youth who are going through something similar, going through the mental health struggles, along with physiological symptoms that are going on and have been hitting a lot of brick walls with people not understanding them, being basically misdiagnosed and misunderstood and feeling really defeated? What are your words of encouragement to those individuals?
I can start and then I can pass it to you, Kat, if that sounds okay. I would tell those patients, know that even if your struggles don't have a clear answer yet, that they are still valid. Because that's something I dealt with for a long time of thinking, oh, it's my fault. It's a personality flaw. I'm the one who's doing this. I'm in therapy. I'm doing all the right things. Why is this not working? And that leads me to the second thing is that mental health is so complex. There are so many things that can play a role into your mental health outside of what we've even talked about within this podcast. And understanding that because it can be so complex, there are other options out there for you to navigate and test out and see what works best for you. For me, I think it took 17 doctors to get a proper diagnosis. So it took a while, but eventually we got there, and my life is drastically different because of it.
Yeah. Yeah, beautifully said, Brandi. Same thing. I think I would tell people to just, hold on to the hope. I think sometimes symptoms can get so bad, it seems impossible to get back to how you once were or to see improvement. And just hold on to that hope and try to get through it, is my main thing, because it can be daunting and you can feel really alone. But if you can hold on, there's definitely the other side. There's a lot of good things.
I really appreciate you sharing that because we all have been through so much through our own journeys, through so many from the pandemic and other things that are happening on the outside, but also the physiological and mental things that are going on the inside. And I love that you mentioned hope because one of the things that really centers and grounds NAMI is the idea that hope starts with us. It starts with you as the individual. And if you keep hope alive and if you continue to advocate for yourself and tell your story, you can't be denied. You know, your story is your truth. No one can change it. And you sharing your truth may empower and encourage other people to do the same. So I hope that our time together has been inspiring for our listeners. I'm looking forward to a packed house at the conference to hear what you all have to say and continue to build our collaboration between NAMI and the Pan Pandas National Youth Alliance. Thank you so much for your time today.
Thank you for having us.
Yeah, thank you for this awesome opportunity.
We'll see you soon.